Namaskar dosto, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic that is workers, something related to ozone toxicity, where the occupational exposure is there for the workers who are working in aviation industry. Then we'll discuss about zinc phosphide poisoning in the options only. Then we'll discuss about metal fume fever as well as the disease which is caused by beryllium metal, that is called berylliosis. Okay, let's directly dive into the question. The question is taken from ABT recertification question year 2009. Question is, a worker in a aeroplane parts manufacturing plants performs welding and multiple machining tasks, many of which require use of diamond drill bit, which is made up of cobalt as well as tungsten. So here try to understand the question. Here there is an occupational setting. Here the worker is working with the metals, cobalt and tungsten. Those workers is experiencing chronic respiratory distress that does not correlate with his work schedule and appears to be worsening. Assuming this condition is work related, the most probable cause is. So you have to understand how these examiners will frame the question is that he will give you a case study. Okay, for example, they will give you something like a farmer is working in certain agriculture land and is working with certain pesticide. So like that we need to they will give you certain symptoms, then you have to identify what is a particular disease. So similarly here also you can see they are giving you a case study and they're trying to confuse you with a giving the metals like cobalt and tungsten, but the right answer will be will be the green text, that is option C, that is reaction to ozone. Why ozone is the right answer? Why not cobalt or tungsten, which is given in the question? We'll see. We'll try to understand. Okay. So ozone is produced by high voltage devices and is irritating to the lungs. So whatever these instruments which this particular worker is working on, he is dealing with high voltage equipment, and these devices they will emit ozone, and this ozone is going to upon repeated exposure and long term exposure, it is going to irritate the lung. So this is I feel that they are trying to confuse you, but the right answer will be ozone. So try to understand and read about this particular thing, how the high voltage devices are releasing this ozone. Here you can see the particle, the free radical ozones are released. Okay, then we'll try to see what are the other options are there. Other option is metal fume fever. Okay, this metal fume fever which causes nausea, chills, and is due to particular metal called magnesium oxide. But we'll discuss one slide with respect to metal fume fever also. Metal fume fever is not only just caused by magnesium, there are other around 7 to 8 heavy metals which are responsible for causing this metal fume fever. So I'll discuss about that one. Then third one is berylliosis. Berylliosis is something which is refers to beryllium induced granuloma and hypersensitivity reaction. So these beryllium particles, when you inhale, they go and deposit in the alveoli, and it is going to trigger inflammatory cytokines like interleukins, and it is going to cause hypersensitivity reaction. So there are certain individuals who are sensitive to this exposure to beryllium, they only will get this type of berylliosis disease. And if you look into the exposure time also, it is not acute exposure. Even after if the worker is working in a certain industry and is exposed to beryllium, after couple of years he will be getting this particular disease. So in such cases, it becomes very challenging to establish a relationship between the cause and effect. Okay, same thing with happened with respect to that is radium gull painters. Okay, next, a hard metal disease which is caused due to cobalt exposure results in cardiomyopathy. I try to retrieve the information as much I could understand about hard metal disease. I didn't get much information about hard metal disease. It is associated with cobalt, but it is causing in respiratory toxicity, inhalation toxicity, that is interstitial lung diseases rather than cardiomyopathy. Probably eventually it might lead to cardiomyopathy. Most of the information I'm getting on heavy metal disease rather than hard metal disease. So if you get any information, you try to read on your own. Then next we'll see. First, let us understand some information with respect to in the option of we have metal fume fever. So repeatedly in the ABT recertification exams, they have asked about metal fume fevers. So very quickly we'll understand what is this metal fume fever. Metal fume fever is an acute, self-limited flu-like syndrome. So the symptoms are similar to that of a conventional flu caused by inhalation metal oxides. Here the metals are what? Zinc, copper, iron, nickel, cadmium, and aluminium. Okay, these are the heavy metals. Exposed to these oxides, fumes, when you inhale these oxide fumes, no, metal oxide fumes, you will get this particular metal fume fever. Most commonly zinc oxide. In the first slide you have seen magnesium oxide. Now here they are saying zinc oxide. During industrial processes like welding, cutting, brass pounding. That's why another name for this is brass pounder egg. Egg is something related to pain. So the first documented medical cases were recorded in 1830 where physicians formally described brass pounder egg among the metal workers. Here the metals here you can see copper, aluminium and cadmium. Here also we have given copper, aluminium as well as cadmium. Okay, so let's see, being a toxicologist, you should be knowing what is the pathophysiology and symptoms. History about this disease, you go back and read on your own. Lot of historical evidences are there with respect to this metal fume fever, which is also called as Monday morning fever. Okay, let's see what is the pathophysiology and symptoms and mechanism. Inhaled ultraviolet particles, particulates usually less than 1 micrometer. So pause here, try to understand whenever you are discussing about inhalation toxicity, no, you should know what is the size of the particle of the particular chemical or dust or mist whichever you are inhaling, and which particular part it is going and depositing, and which process, whether it is impaction, sedimentation, diffusion. So this diagram I keep repetitively in my videos. So here, see here the ultra, whatever this metal fume particles are there, no, they're ultrafine particles. They're less than 1 micrometer. So whenever that it is less than 1 micrometer, it will go and deposit in the alveoli, causing an immune release of pro-inflammatory cytokines. So this is going to cause inflammation. So what are those inflammatory mediators? TNF alpha, interleukin 6 as well as interleukin 8, which are responsible for causing this immune mediator reactions. How much time once a person is exposed to this metal fume fevers? It will take around 4 to 12 hours after exposure. For example, if a worker is working on a day Monday or Tuesday, after working in that particular conditions, after 4 or 12 hours, he will start showing the symptoms. Key signs are high fever, intense shaking chills, profound fatigue, myalgia, that is muscle pain, a sweet metallic taste. So one question with respect to this also they'll say, in the symptoms they'll give, the person is showing metallic taste. Then you have to understand what are the, probably it is because of heavy metal poisoning in the mouth and dry throat. So as I told you, know, in historically this particular metal fume fever is also known as Monday morning fever. Why it is called Monday morning fever, we'll see. Tachyphylaxis, the body develops a temporary tolerance. So this is again very, very important. Coming back to principles of pharmacology or principles of toxicology, you should be knowing what is tolerance, what is sensitive individuals. Okay, there are key, there are some drug dependence. So these are the things that you have to remember. So here this metal fume fever is associated with some that concept called tachyphylaxis. Means temporary tolerance will be there to the individuals who are exposed. The body develops a temporary tolerance to metal oxide fumes with repeated daily exposure. That worker who is working in this particular factory, he is like from Monday to Friday, he is getting exposed repeatedly to that particular metal. So you'll start developing a tolerance. Okay, the cycle. Even you have alcohol tolerance or drug abuse, they have tolerance, no. So keep that concept in your mind when you're reading this one. Workers often feel fine by Thursday or Friday. So the particular worker who is working from Monday to Friday, after exposing to these metal fumes, he will be fine. But after taking the weekend off, means on Saturday and Sunday, he will get fever. Reducing exposure, they lose this tolerance. Returning to work on Monday and triggers a severe reoccurrence of symptoms, hence the name Monday morning fever. So go back, pause here and try to understand. And also here you can see different symptoms, prevention, why it is called Monday morning fever and common causes. Read and try to remember in the options. If they give you any of these metals, try to remember and answer the question. Now we'll read something with respect to beryllium. So occupational lung disease, which is caused by exposure to this beryllium metal, no, it is called berylliosis. So berylliosis also called as chronic beryllium disease. It is an occupational lung disease caused by inhaling dust or fumes containing beryllium. It triggers an allergic type immune response, similar to like that of metal fume fever. Again, this is also triggering your immune response, causing inflammation, scarring, that is granulomas in the case of lungs. Okay, most cases in occur in aerospace, electronics, and nuclear manufacturing. These are the particular kind of exposure areas, working conditions where the workers might get exposed to this beryllium metal. Causes and risk factors. Agent beryllium is a light metal weight used for its strength and its heat resistance. It is mechanism not it is not a direct poison. So here you can stop the video and you can go through how it is causing direct toxicity, how it is going to affect different cells in the alveoli. Okay, not direct chemical poison occurs in individuals who develop an immune system sensitization to beryllium. As I told you, no, not every worker will be getting this particular berylliosis disease. There are certain individuals who are having some genetic susceptibility will be there. They are who are highly more sensitized to this particular metal. They will only will be getting this disease berylliosis. So there is a genetics association will be there. So in the ABT brochure also genetic related thing is given in the syllabus. So sensitive individuals, so like that you have to remember. So this is an example for that. So people with whatever this particular genetic marker is there, HLA DP beta 1, have a significantly higher risk of developing sensitization and this chronic beryllium disease. And if you look into the symptoms, no, we have it will take around months or years to appear after initial exposure. So that is what I was saying. There are certain working conditions where the workers are working and they get a disease after 5 years or 4 years. It becomes very challenging for them to claim for their loss. Okay, they have to go a lot of legal cases because they cannot establish the cause and effect relationship. This thing has happened with respect to mercury, that is mini matter disease. This thing is also noted in the case of radium dial painters, where they couldn't establish the that whatever the symptoms they had, the disease was associated with the working conditions. Okay, so these are the various symptoms you can see with respect to berylliosis. Okay, now we'll see the third, another question which was taken from ABT recertification year 2009 only, something related to zinc phosphide poisoning. So the question is, which of the following produces toxicity of ingested zinc phosphide? So whenever you are reading about rodenticides, that comes under pesticides only. Under pesticides is a bigger umbrella in that you will read about weedicides, herbicides, fungicides, rodenticides. So in that rodenticide, so zinc phosphide is something which is used as a rat kill poison. So it is zinc phosphide. So question is, which of the following produces the toxicity of ingested zinc phosphide? The right answer will be in the green text, that is phosphine formed from hydrolytic reaction of water in the stomach. See, once you orally consume this particular zinc phosphide is nothing but Zn3P2. Okay, so when it comes in contact with water which is present in your stomach, okay, so it will undergo a reaction and it will release phosphine. What is phosphine? pH3. And this, whatever this phosphine, no, it is highly toxic. And the symptoms and the toxicity is similar to that of the cyanide poisoning. Okay, so we'll see other options also, why those options are not right. Zinc released from hydrolytic reaction of water in the stomach. Zinc is not releasing. As you can see, phosphorus is phosphine gas is releasing. Zinc oxide formed in the stomach? No. See, when zinc comes in contact with oxygen, zinc oxide will form. But in the stomach, water is there, HCl is there. Also, third option is also not right. Phosphoric acid formed in the stomach? No. Here pH3O, PHO3, those things are not forming because here zinc is not reacting with hydrogen sulfuric acid. H2SO4 is not there in your stomach. HCl is there. And phosphorus released from hydrolytic reaction of water in the stomach. Elemental phosphorus is not releasing. Phosphine gas is releasing in your stomach. Okay, that is the reason why the other options are not right. Little bit of concept with respect to zinc phosphide toxicity, which was given by the previous DABT students, will go through quickly. The toxicity of zinc phosphide can be accounted for by the phosphine gas. As I told you, pH3, this is the gas which is released. formed on ingestion following a hydrolytic reaction. This is what type of reaction that you have to remember, with water in the stomach. So whenever this zinc phosphide it is coming in contact with the water in the stomach, it is releasing phosphine gas. Phosphine causes widespread cellular toxicity. So here you can see it causes cellular hypoxia. It will deprive the cells from the oxygen. As a result, they undergo necrosis. With necrosis of the GI tract, so whatever the lining, stomach layer lining will be there, no, those cells will die and injury, and eventually it will also cause toxicity to the liver as well as your kidney. So cases of human poisoning have been reported. You can go and check historically. N number of cases are there where accidentally people have consumed, or suicidal intensity also they have consumed this rat kill poison, that is zinc phosphide. So recent case you can see that zinc phosphide rat poison, there was a case study, a family of 4 members were killed because of the consumption of the watermelon which was contaminated with this particular pesticide, that is zinc phosphide. So you can go back and read about this particular news also. And with respect to phosphorus toxicity, I have discussed about different types of phosphorus like yellow phosphorus, red phosphorus, white phosphorus, and the recent use in the case of yeah, how it is used as a warfare agent. So all those things I have discussed in this particular video. I'll give the link in the description. You can go and read in detail about phosphorus toxicity. So any questions with respect to phosphorus also you will be able to address in the exam. So in this video we have discussed about metal fume fever. What are the heavy metals which are responsible for causing metal fume fever? We have seen ozone, which is coming from aviation industry. Workers who are exposed to ozone will cause irritations of the lung. Then we have discussed about the beryllium, berylliosis. So some questions with respect to occupational hazards they will be asking, and we have discussed about zinc phosphide, rat poison, and phosphorus type of phosphorus, different types of phosphorus, how they're going to cause toxicity. Okay, thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.